Hey there! Today, I'm diving into something truly groundbreaking in the world of heart health. We're talking about a revolutionary heart valve treatment that's changing lives without the need for traditional surgery. Intrigued? Let's get into it. First things first, what is a heart valve? Your heart has 4 valves that keep blood flowing in the right direction. Sometimes these valves don't work properly, which can cause serious health issues. That's where this new treatment comes in. Traditionally, heart valve replacement required open heart surgery, but not anymore. The new method is called transcatheter aortic valve replacement, or TAVR for short. Instead of a big incision, doctors use a catheter, a thin, flexible tube, to replace the damaged valve. This is usually done through a small cut in the leg or chest. So, how does TAVR work? Well, it's pretty fascinating. The catheter is guided to your heart through your blood vessels. Once it reaches the damaged valve, a new valve is expanded, pushing the old one aside. The new valve starts working immediately, ensuring your blood flows correctly. What makes TAVR so revolutionary? First off, the recovery time is much shorter compared to traditional surgery. Patients often go home within a few days. Plus, it's a great option for those who might not be good candidates for open heart surgery due to age or other health conditions. Of course, like any medical procedure, TAVR isn't without risks. Possible complications can include bleeding, infection, or issues with the new valve. But for many, the benefits outweigh the risks. Always talk to your doctor to see if it's the right option for you. So there you have it. A game-changing heart valve treatment that offers a less invasive, quicker recovery option for those in need. If you found this video helpful, don't forget to like and subscribe for more health insights.